Good afternoon. I'm Jane Barrow, Associate Dean for Global and Community Health at Harvard School of Dental Medicine. It is my pleasure and honor to welcome everyone today for a very special seminar series event featuring Dr. Jerome Adams, United States Surgeon General, and Dr. William Ginobili, Dean of the Harvard School of Dental Medicine. Today's special event will feature a half-hour presentation by Dr. Adams, followed by about 15 minutes of questions. We ask that you submit your questions into the chat function during the presentation, and then we will address them after the presentation. Now, I would like to introduce you to Dr. William Ginobili, Dean of the Harvard School of Dental Medicine. He is a leader in the field of periodontology and an internationally recognized scholar in oral regenerative medicine, tissue engineering, and precision medicine. He is an alumnus of Harvard School of Dental Medicine with an advanced degree in periodontology and oral biology. And in September of this year, he was appointed the 11th Dean of HSDM. So welcome, Dean Ginobili, and thank you for joining us today.
Well, thank you so much. I really appreciate your kind remarks and really appreciate your leadership in organizing today. It's really an honor for us to be able to welcome our nation's Surgeon General to meet with us today. And so I'm delighted to have this opportunity. And so just to give you a brief introduction on our Surgeon General, Dr. Jerome Adams is the 20th Surgeon General of the United States. And he has bachelor's degrees in biochemistry and psychology from the University of Maryland, Baltimore County, a master's of public health degree from UC Berkeley, and his MD from Indiana University School of Medicine. He's a board certified anesthesiologist, and he has previously served as the Indiana State Health Commissioner from 2014 to 2017, where he presided over Indiana's unprecedented HIV outbreak caused by injection drug use. And so Dr. Adams' motto is better health through better partnerships, a description of his commitment to maintaining strong relationships with the public health community and forging new partnerships in other sectors. He's a member of the President's Coronavirus Task Force, and earlier this year he released Smoking Cessation, a report of the Surgeon General. This is the 34th report on tobacco, and it was the first report on cessation in 30 years. So as Surgeon General, Dr. Adams oversees the operations of the U.S. Public Health Service Commission Corps, which has more than 6,000 uniformed health officers who serve to promote, protect, and advance the health and safety of our nation. And at a personal level, about 2 years ago, I had the privilege to meet Surgeon General Adams in the launching of the process for the development of the Surgeon General's report on oral health. And I can state that Surgeon General Adams is a dedicated and genuine enthusiast in the support of our nation's health and oral health. And I think our country is fortunate to have his leadership as a healthcare leader supporting our nation's oral health care agenda. And so with this background, we're very excited to listen to your presentation today, and we greatly appreciate you making time for us as well to allow some question and answer at the end of your presentation. So, Surgeon General Adams.
Well, thank you so much, Dean Ginobili, for that kind introduction. You obviously haven't been on my Twitter site lately because you sound completely different than the people on there and what they say about me. But I just also want to give a shout out because, gosh, I thought anesthesiology was hard to pronounce, but periodontology, that takes the cake. So just really grateful to be here with all of you and virtually connect to provide updates regarding the importance of oral health in the context of the COVID-19 pandemic, because one of the challenges is that a lot of times people focus on the problem of the moment and forget about everything else that's going on. We cannot afford to do that. And I want to start off by thanking all of the healthcare and public health professionals listening for your steadfast dedication and commitment to improving the health and well-being of all Americans. Many of you have faced threats to your lives and your livelihoods, worked long and stressful hours, and through necessity, you found new ways to innovate. And I want you to know your contributions have strengthened and protected families, communities, towns, and cities across the nation, and we are grateful for your efforts. It's truly a tragedy when you look at the number of people who have been impacted by this virus. But I want to remind you that back in March, April, there were estimates that 1 to 2 million people could have died from this virus by now. So if nothing else, that should go to show you that your efforts have had an impact. We need to not pat ourselves on the back. We need to keep doing better, but no doubt you have saved lives. It goes without saying, these are unprecedented times. The pandemic has hit everyone hard, but particularly affected healthcare professionals, homeless and incarcerated individuals, people of color, and vulnerable individuals with underlying conditions or who are older. Tragically, we're approaching 270,000 fatalities due to COVID, and we've exceeded 13.6 million American cases diagnosed. Those are the current facts, but the numbers don't tell the whole story. The pandemic has been challenging for every single one of us, whether you've had COVID or know someone who's had it or not. It's affected our mental health, our physical health. It's affected our businesses. And many of us are experiencing what I call pandemic fatigue, that feeling of exhaustion with the mask and the isolation and the loss of traditional celebrations and comforts. It can seep in and it can influence our behaviors and choices. And that fatigue can also increase our chances of contracting and spreading the virus. The pandemic has also revealed the psychological harm of physical distancing, a tactic we strongly recommend in order to slow viral spread, and is effective in reducing the risk of infection, but can lead to social isolation and cause our mental health to suffer. Despite sadness, frustration, impatience, I'm asking you to remember to focus on what works, to commit to each other's health and well-being, and to find compassion for each other and for yourselves as we mitigate the effects of this invisible adversary. Dental professionals have played an important role during the pandemic, if an underappreciated one. You've helped the entire clinical community understand best practices around oral hygiene that can reduce COVID-19 transmission in situations where a face mask simply can't be worn. I applaud your collaboration across medical professions to ensure the health and safety of patients and of practitioners. Both during COVID-19 and beyond, you play a critical role. And we know that oral health is integral to our overall health, as well as the health of our communities and our nation. Many Americans still don't understand that connection between oral health and overall health. But I often say, and many of you may have heard me say this, that a long time ago, we separated the head from the rest of the body when we talk about health. But separating out vision, mental, and oral health has, in my opinion, been a disservice to our nation in many ways. We know that good oral health represents the ability to eat, speak, and smile. But it also means freedom from pain that can interfere with normal functioning and put you at risk for substance misuse, because we know many people self-medicate away the pain that they feel from poor oral health and poor dentition. And as you know, many systemic diseases such as AIDS first become evident through oral health symptoms. In addition, an unchecked oral health issue can even be fatal if gum disease reaches the bloodstream, a heart valve, or other body part. Dental infections and gum disease have been implicated in conditions like chronic obstructive pulmonary disease, adverse pregnancy outcomes, poor glycemic control in diabetics, cardiovascular diseases, and more. And not everyone has good oral health, unfortunately. We continue to see significant health disparities in our country. Overall, Blacks, Hispanic Americans, American Indians, and Alaska Natives suffer the poorest oral health of any racial and ethnic groups in the United States. Key oral health outcomes related to disparities include dental caries, periodontal disease, edentulosum, and oral cancer. You see, when we think of health, including oral health, many of us immediately think about health care. But what I want you to understand is that as critical as healthcare is, overall health, and especially oral health, actually begins at home. And in a vicious cycle, what we call social determinants, things like a living wage, clean drinking water, housing security, they contribute to medical determinants, chronic diseases such as diabetes, periodontal disease, and hypertension. So it should be no surprise that all of these diseases are especially common in people of color. It in most cases has very little to do with any genetic or inherent traits, but everything to do with social pre-existing conditions that put individuals at risk for disease, including infection with COVID-19. For instance, we know that social distancing and teleworking are critical to preventing the spread of coronavirus. Yet only 1 in 5 African Americans and 1 in 6 Hispanic Americans has a job that allows them to work from home. We know people of color are more likely to live in densely packed urban areas and in multi-generational homes. So what does it mean when we tell someone you've been diagnosed with or exposed to COVID, go home and quarantine and isolate, if we don't take the next step and find out that they live in a 2-bedroom apartment with 8 or 9 other people sharing a single bathroom? These factors create greater risk for spread of a highly contagious disease like COVID-19, and again, put people at higher risk for complications if they're infected with COVID-19. Oral health professionals and their practices can and do tackle disparities in the course of their care delivery. However, the dental industry, like the medical industry as a whole, can and must do better. One of the things we can do is work harder to recruit diverse people, people of color, into the education and career pipelines. Studies show that people of color feel more comfortable and often have better outcomes when they see a clinician looks like them. Less than 4% of all dentists are Black. That's representation at a rate of 1 to 3 compared to the population. As an additional element that leads to disparities, we know that health and the economy are inextricably linked, and socioeconomic status is tied to an individual's health outcomes, including oral health. The pandemic has made this linkage even more apparent. Poor oral health, it feeds back on these social determinants and has significant educational and economic consequences. For example, 51 million school hours are lost each year due to dental problems in children, and the average adult misses over 2 days of work each year due to dental issues with themselves or their families. So these social determinants lead to medical determinants, and the medical determinants feed back and worsen these social determinants. I make these points and more in my upcoming Surgeon General's report on community health and economic prosperity, or CHEP, which will be released in the next several months. As you know, the health of Americans is not as good as it could be, and we pay much more for healthcare than many other countries, a combination I call the US health disadvantage. And this health disadvantage costs businesses money. My report maps out ways for businesses to address the US health disadvantage by engaging with and investing in communities, while also creating value, lowering costs, and improving the health of employees and other stakeholders. Efforts to improve community health and recover economic prosperity will be insufficient without actions by business leaders. So let me state the obvious. Businesses are a force for good in our society, creating wealth, jobs, value, paying taxes, and offering goods and services and innovation to the market. They can also be a huge force for good in addressing the US health disadvantage and health disparities. So my mission with CHEP is to mobilize businesses to invest deeply and over time in the health of their communities, including taking measures to improve oral health, because we know this will not just improve health, but it will create a healthier bottom line. So stay tuned for that report and help me disseminate it when it comes out. Also within the next few months, early 2021, I'll release a spotlight on oral health. My spotlight on oral health will provide a glimpse of the full report that will follow in 2021, the first Surgeon General's report on oral health in 20 years. The spotlight will preview the report's examination of some important issues affecting oral health across the lifespan, including children, adolescents, adults, and older adults, the integration of oral health and primary care and workforce issues, the relationship between oral health and substance abuse disorders, the opioid epidemic, high-risk behaviors such as smoking and vaping, and emerging technologies and promising science that is transforming oral health and health delivery. Additionally, my Surgeon General's report will help to shine a light on disparities as they relate to oral health. As general professionals, you're trusted sources of clinical and health-related advice. Critical team members with unique roles in answering patients' questions, providing and translating scientific information, and more. We know patients may be more likely to see a dentist instead of a physician, as annually approximately 9% of Americans see a dentist, but not a medical doctor. Dental professionals also help to educate patients about chronic diseases such as diabetes, hypertension, and heart disease. So kudos to all of you who've helped diagnose or treat someone's high blood pressure by screening in your offices. I ask you to please continue your work in promoting overall health, again, including checking patients' blood pressures to help identify conditions such as uncontrolled hypertension and preeclampsia. And on this note, in October, I released the first call to action during my tenure as Surgeon General, working to improve the control of hypertension. High blood pressure is common. 1 in 2 adults have it. It's costly, but it's controllable. Yet it is stunning to hear that only half of US adults have their high blood pressure under control. And lack of control reaches 80% in Hispanic and Black Americans with hypertension. Uncontrolled hypertension leads to heart attacks, strokes, kidney disease, and even maternal morbidity and mortality. And many of these conditions are associated with more severe complications from COVID-19. So again, we can't ignore them in the midst of a pandemic. I want to make hypertension control a national priority, saving lives, suffering, and dollars. So I ask that you go to surgeongeneral.gov to learn about what you can do to bring our national blood pressure down to normal. And earlier today, you're catching me right in the moment. I released a second call to action, this one on improving maternal health. A woman dies every 12 hours in this country due to pregnancy-related complications. This is unacceptable, but it is not inevitable, as over 2/3 of these deaths are preventable. I also highlight that women of color suffer more complications. A Black woman with a college degree is still almost twice as likely to die from pregnancy-related complications as a white or an Asian American who never finished high school. These calls to action highlight the underlying theme throughout all my work, which is understanding and addressing the reasons for existing disparities and finding effective methods to advance health equity. So again, go to surgeongeneral.gov to learn more. I want to close with next steps for addressing the pressing issue of COVID-19. In regards to vaccination, we're making rapid progress in the development of effective vaccines and in plans to ensure its equitable distribution. But I need your help to promote vaccine confidence. When these life-saving vaccines are ready, we need to be ready to protect all Americans against COVID-19 because it is not the vaccination, but the immunization that actually matters. And we need to make sure we're getting these vaccines into the bodies of the people who are most vulnerable. In order for vaccines to end this pandemic, we have to acknowledge and address obstacles to vaccination, and in particular, those encountered by racial and ethnic minority communities. Vaccination in those groups already lags far behind poorer national averages. For example, only about 40% of Hispanics, Native Americans, and African Americans get their yearly flu vaccine versus 50% of whites. Rates of pneumococcal vaccine exceed 70% in whites, but are just over 50% in Blacks and Hispanics. And I want to point out another area where we have disparities that I always politely call out my oral health colleagues on. How many of you have done an oral cancer screening and known that the #1 risk for oral cancer behind smoking is HPV, but not taken the time to ask someone if they've been vaccinated against HPV? It's critical that we all take on the role of promoting vaccine confidence so that we can not only end the COVID-19 pandemic, but end the pandemic of other vaccine preventable diseases. And while we're optimistic about an upcoming COVID-19 vaccine, I want to finish by reminding you, there are simple measures everyone can practice now to lower spread, decrease risk of severe complications, and move safely towards reopening. Our best immediate defense against COVID-19 are what I like to call the 3 W's. Wash your hands, wear your mask, and watch your distance, meaning avoid crowded indoor spaces, stay 6 feet from others wherever you can, and try to minimize contacts with people outside of your household. And again, it's imperative that you all get your flu shot and encourage everyone else to do the same so that we can prevent a dual pandemic from overwhelming our health systems. I encourage each of you to bring your clinical expertise and experience to bear in your communities, because we live in an age of misinformation. And as trusted leaders, I want you to know our nation's future is in your hands. The power to stop the spread of this virus lies within each and every one of us, but we need to have the motivation and the education to actually take simple measures. This holiday season, remember, keep your gatherings small and ideally held outdoors with proper distancing and mask wearing. As you all know, many people who are infected do not have symptoms. Up to 50% of people who are spreading the virus are doing it asymptomatically. So keeping a safe distance and using masks along with frequent hand washing are critical to protecting family and friends, especially our elders who are most at risk. You can go to my Twitter handle @surgeon_general and see a video I created as part of our campaign, #COVIDStopsWithMe, helping people understand that COVID really does stop with each and every one of us. I want to finish by saying we've learned a lot in the last 11 months. We know much more about who is at risk from COVID and why, and we're doing a better job of protecting them. We know how to treat those most severely affected. So many people who are being diagnosed are now living with COVID as opposed to dying with COVID. We know that we have to address the underlying drivers of disparate outcomes, those social conditions that can either limit or unleash a healthy future. And we know what works to keep people and their communities safe. So have heart. We'll begin vaccinating people within weeks. We are almost to the finish line. And excuse me, many of you are there in Boston. Many of you have run the Boston Marathon. You know that the last few miles of a marathon are the hardest ones. And when your legs turn to tree trunks, they're when it becomes incredibly difficult to keep slugging forward. But if you know that finish line is in sight, if you can see it, and if you're being encouraged by people on the sidelines to do the right thing, then you can run through the tape. That's what we need to do now with COVID-19. Take simple measures, protect ourselves and our communities until we get to a vaccine. So thank you so much. Take a deep breath, stay committed to your mission, and know that I am hopeful. I'm optimistic that together we can and will get through this. So I see some questions already coming in on the chat. Dr. Gianobili, I'm assuming you're going to moderate the chat, but happy to have a conversation with people now.
Okay, well, thank you very much. Surgeon General Adams, this was an inspiring presentation. And as you saw, that we've got a lot of questions coming in. We have over 300 in attendance, so there's been a lot of enthusiasm and interest coming forth on your presentation. And it's exciting to hear also the optimism that you're demonstrating as well with these vaccines coming online. And so, I guess several of the questions that have come through, I'll start with one of the big questions many have been asking. First of all, we were happy to hear about the 2021 release of the Surgeon General's report on oral health. I know many people who are on this webinar were contributors to this report, and it was really an interesting process and team effort to come together in so many different areas, from prevention, epidemiology, new technologies, and I think it'll be exciting to see that come forward. So many of the questions have come forth regarding vaccines, and as you mentioned, they're going to be coming online very soon. And many of us in the oral health community have these questions ranging from, are dental healthcare workers going to be considered frontline workers, because we're involved in the oral health and delivery of healthcare. And then the second part is based on our expertise. Will dentists and auxiliaries have the ability to help deliver vaccines? And so we hope you might have some insights on those.
So what we are going to do is review the Advisory Committee on Immunization Practices recommendations, and they met earlier this week. They took into account the National Academies of Science, Engineering, and Medicine recommendations. And one thing I can tell you is that we all agree healthcare workers should be in that first tier. There's some debate over whether it should be people in long-term care facilities at the top of that first tier versus healthcare workers versus other people. But the fact is they're all in that top tier, because what we want to do is immunize for impact. And that entails making sure we're getting the vaccinations to the people who are either most likely to be harmed by COVID or most likely to be exposed to COVID. Now, I want to really share something important with you all. When we dig deep into the data, healthcare workers actually, compared to the population, are at lower risk for getting COVID-19, and that most of the healthcare workers who are being exposed aren't being exposed in patient care encounters. They're being exposed in the break room. They're being exposed when they let their guard down and they're around people outside their household. And so I want to remind you of that, because even before you get your vaccine, there are measures you can take to stay safe and protect yourselves and your communities. I want you to know that we believe the ultimate decision as to who gets the vaccines first will be decided by the states. In the US, we have a federalism set up, and the states have a lot of the power and authority. What we're going to do is send proportional doses of vaccine to all the states and territories. And then we're going to give those states and territories guidance about how they should think about who should get the vaccine, and then they will decide. And I want you to know that I agree with you. Dental and oral health workers should be considered in that top tier of healthcare workers. But of course, stating the obvious here, if you are truly engaged in elective procedures and procedures that are being pulled down, that should be a lower priority, whether you're a dental worker, a dentist, or a physician, compared to if you're someone who is engaged in emergency and emergent procedures and on the front line. So I think you all should be thrown into the bucket. And then I think we need to take a closer look at who is truly at greatest risk for being exposed. As far as administering the vaccine, you hopefully have seen that we amended the PrEP Act several times to allow pharmacists greater ability to administer vaccines. I don't see any medical reason why we shouldn't include dentists. What I do want to say is that there are real practical concerns. This is going to be the hardest vaccine to administer in the history of the United States. We're going to have multiple different versions of it out there, hopefully, which is a good thing because more people can be vaccinated. Some are going to be 1 dose, most are going to be 2 dose. And we're going to need to make sure we have systems in place to really track who got what, when. And the honest truth is that we know that infrastructure lies in doctors' offices, in clinics, and in pharmacies because they've been doing this. Whereas dentists, I have no problem with them from a medical perspective being able to administer this vaccine. But what's going to be more difficult is making sure the logistical infrastructure is in place so that if you do give a vaccine, that we know 6 months from now that a person was vaccinated, or 21 days from now that they got the Pfizer vaccine and not the Moderna vaccine. That's the bigger challenge that we have to overcome. And I am 100% willing to work with you all in your organizations to figure out if there's a way that that can be done so that we can do right by the patients. But I think we need to continue to try to leverage opportunities from dentists providing alternative means of care and alternative opportunities for care to help not just with COVID, but with flu, with HPV, and beyond. And I saw a question pop up asking what more you can do. I want to reiterate, you have a great opportunity when you're standing over someone, examining them during the winter months to ask, did you get your flu shot? and to have a conversation with them about the safety and efficacy of a flu shot. There's no better opportunity than any health provider has to talk about the HPV vaccine than when you're standing over someone doing an oral health and oral cancer screening. So take advantage of your opportunities to promote vaccination, and that will have as much, if not a bigger impact than you actually being able to administer the vaccination, which again, I'm willing to work with you on.
That was a very helpful perspective, and I appreciate you underlining the point in terms of the healthcare setting and the dental setting as well, that these are very safe environments for patients to walk into. You're aware of the recent report in Journal American Dental Association as well, demonstrating the low rate of infection amongst dental healthcare workers, and there's no evidence of that transmission within the dental office. So encouraging data there. Along the lines of some additional questions we're seeing coming up, again, many of them circling around COVID infection. And as you mentioned, people of color, people with other types of risk factors in terms of those individuals having poorer outcomes and greater risk of different issues with death, and extent of patients who may have diabetes, obesity, or a genetic predilection to developing the cytokine storm. And so did you want to comment on this in terms of looking at our different patient populations on how they're affected?
Great question. And I want to be clear, we are learning more about this virus each and every day. And we're quite frankly flying the plane as we're building it. And one of the challenging things, I got asked this question on CBS this morning on a news show just this morning, what is one of your biggest regrets? And my answer was, one of my biggest regrets is that we didn't do as good of a job as we could have at communicating the uncertainty of this novel coronavirus and helping the public understand that information today can, and in many cases likely will, change further on down the road. But that doesn't mean you shouldn't trust scientists or health professionals. That means that that's the way science works. We give you the best advice we can based on the information right now, and then we adjust that advice when we get new information. That's what you want to happen with science. And you saw that happen with masks. You saw that happen with testing guidance. You saw that happen with the new quarantine guidance that recently came out. How does that bridge back to what you were asking about? We're still investigating any genetic predispositions to negative outcomes. But as of right now, we do not believe that there is any racial genetic predisposition to a negative outcome. What we believe is that there are significant social pre-existing conditions which lead to negative outcomes among the ones that I mentioned. People of color more likely to use public transportation, more likely to have frontline jobs, less likely to be able to telework, more likely to live in crowded indoor spaces and in urban areas. And so from a health and science point of view, we always want to go after the genetic component. We always want to figure out what can we do in the doctor's office or in the clinic to fix the problem. And my wife always gets on me because she says, sometimes I don't want you to try to fix the problem. I just want you to listen. Well, we all need to do a better job of listening to our patients, understanding the conditions in which they live, and then figuring out ways we can intervene to help deal with those upstream predictors, because you're going to have a bigger impact there. That's about 80% of your health versus about 20%, which is what happens when you come into the clinic. We want you to be able to take care of a dental carie or an abscess when someone comes in, but we'd much rather have you advocating for fluoridation and good oral health care way upstream so that people don't show up in that situation in the first place. So remember that when it comes not just to COVID-19, but to an array of other diseases, hypertension, maternal morbidity and mortality, periodontal disease, that in many cases, these things were set in motion years before they ever showed up in your office because of social pre-existing conditions, not so much because of any genetic conditions that individuals have.
That's very insightful. And I think, really combining the social determinants of health in addition to all the biological determinants, I think are so important. It's a great example, I think, as we look at the pathogenesis of COVID-19 and how it's affecting our patient populations. There was, regarding this oral systemic link, and, we do have a lot of young people who are in attendance today, and looking at, your dedication and support to oral health. There was a question that came up, how did you get interested in an oral health, and why did you choose to highlight oral health in the Surgeon General's report? I think many are intrigued about that because this is a rare event during any administration to do these full reports. And it had been 20 years since the last one on oral health. So do you want to give some insights for our community?
Well, I'll go back a little bit, and people ask, why an anesthesiologist as Surgeon General? They think it's the weirdest thing in the world to have an anesthesiologist as the nation's doctor. Well, I'll tell you, the epidemic we were dealing with when I became Surgeon General was the opioid epidemic. And who better than an anesthesiologist to understand opioids and naloxone and the impacts that they can have on a body. That turned into the COVID pandemic, which is a respiratory disease where the biggest problem we had earlier was ventilator management. Who better than an anesthesiologist? And when it comes to oral health, a lot of my interest comes from the fact that as an anesthesiologist who intubates people regularly, I've seen poor oral health, and I've seen how that is correlated with poor overall health time and again. It's something that I really tried to lift up when I ran the State Department of Health in Indiana, because the Division of Oral Health was part of the Department of Public Health. And it's something that I do believe the science shows is a predictor of and opportunity to intervene in some of these other chronic diseases like hypertension and diabetes and cardiovascular disease. And in addition to having my MD, I have my master's in public health, and my emphasis was in chronic disease prevention. You can't prevent many chronic diseases if you don't ensure good oral health. So I'm committed to this. I'm also very aware of the fact that some of the worst disparities you'll see in this country on a racial and ethnic from a racial and ethnic standpoint exist in the arena of oral health. And so as someone who's committed to health equity, you cannot achieve health equity in this country unless you achieve oral health equity in this country.
Thank you. Perfectly stated.
Absolutely. Dr. Adams, just following up on your community health and economic initiative, one thing that many of us are concerned about right now is the economic impact of COVID and the fact that states are re-examining their budgets very carefully, and that Medicaid is something that is being looked at with a fine-tooth comb, particularly dental benefits. And I'm wondering if you could comment on what you think might be happening with Medicaid budgets and how we as stakeholders and advocates can become involved and persuade policymakers that it's very important, particularly right now when disparities may be widening given everything that's going on. How can we get the message to our policymakers, and what can we do?
It's a great question to kind of wrap things up on. And I want to start off by saying to the young people, I became Surgeon General not because I always knew I was going to become Surgeon General. I never even dreamed of being a doctor when I was younger, not because I didn't have the grades, but because it wasn't until I got to college that I ever met another African-American physician. Representation truly does matter, and it's why I'm proud to serve as United States Surgeon General. But once I got into the health field, I started off back in college and then through medical school and residency, being an advocate, being part of my state association, going to the state house, going to Congress and talking to my congressional leaders and really helping them understand how the issues that they were voting on could impact my career, but the people who I also am trying to serve. So to the young people out there, I want you to understand how important it is that you get involved now and become an advocate. I'm not allowed to tell you to join political action committees, but many professional organizations have political action committees. So it can be as simple as sending $20 or $50 to your political action committee so other people can advocate. It can be as simple as picking up a phone and calling your local legislator. And you'd be surprised how often less than 10 phone calls can sway a legislator's decision on a particular issue, because many people don't take the time to make that phone call. And you'd be even more surprised how powerful it can be when you show up in your white coat to that legislator's office in DC or in their home district and say, I work in your district, here's what I'm seeing, and here's why I need you to really focus on this issue. Now, that said, I'm deeply concerned. We've spent more money in this past year as a nation than we've spent in the last 10 years in terms of allocations from Washington, DC, trillions and trillions of dollars. And we're looking at another multi-trillion-dollar package to help people survive COVID. That's not a bad thing. It's an appropriate thing. But the reality is that we got to pay the piper at some point. And we are going to go into a time of austerity at some point in the future after we get past this vaccine and past this pandemic. What I'm trying to do with my community health and economic prosperity report, with my oral health report, which has a very specific section on the economic impacts of poor oral health, is help people understand that you really are chopping off your nose to spite your face if you cut back on investments in oral health. We need people to understand that poor oral health is a major reason why people don't show up to work on time, or why people become addicted to opioids, or why you have all these other negative problems which are actually pulling down our economic competitiveness. Number 2 expense for most companies out there now is healthcare. And again, we need to do a better job. We all need to do a better job of helping people understand oral health promotes and leads to better overall health, which leads to these economic measures that people care about: job growth, wage growth, decreased healthcare costs. And all of those are going to be in my 2 reports. So that's what I'm doing. What I need you to do, especially the young people out there, is call up your legislator now, talk to them, help them understand how important what you do is, not just to your bottom line, but to the overall health and economic health of your communities and of our country. And you've got to do it now, because otherwise, I often say the problem with oral health or anything from the head up, oral health, mental health, vision health, is we see it as the tinted windows on the car and not the engine that makes the car go. We've got to shift from seeing it as an option that is nice to have to seeing it as an integral part that is a must have. And I'm committed to working with all of you to help Congress see this. But your congressmen, and studies show this, are going to be more likely to listen to you as a constituent of their districts than they will to listen to the Surgeon General of the United States. So you have as powerful of a voice and as great of a responsibility in this space as I do as Surgeon General. So let's work together and help everyone understand you can't have health equity without oral health equity, and you can't have an economically successful country if you have an unhealthy country.
Well said. Thank you so much. Thank you so much. This has been an amazing session. We are so grateful to you for your time today and your very powerful message.
Thank you, Ralph. I see you. Sujay, thank you. Helene, Michael, everyone, I really appreciate the opportunity to be here today. I wish I could be there in person. And once we get through this pandemic, and we will, hopefully you all will invite me there.
Absolutely.
We can unveil the oral health report in 2021 in person.
Fantastic. It was a standing invitation.
Thank you. Take care.
Thank you so much.
Take care.
Thank you. Thank you. Take care, everyone. Bye-bye.
Thanks all our participants for being here today.
Thanks, everyone. Bye-bye.